You might currently be feeling rubbish. You might have cough, cold, snotty, headache, muscle aches, feeling really tired. You might be thinking, is it just a cold? Shall I just let it run out? Shall I call GP practice? Do I need antibiotics? So let's try and answer some of those questions, find out why if you don't get antibiotics, it's not necessarily such a bad thing. So in people who are otherwise healthy and they have a respiratory tract infection, the guidelines are actually now not to give antibiotics in most cases. That's because most of the cases are actually viral. So when we think about sore throat, sinusitis, bronchitis, around about 95% of these are viral, and antibiotics do not treat viral infections. So they won't make you any better any faster, and 1 in 10 people get side effects. That can include diarrhea, it can include a rash, and it can include nausea and vomiting, which can be worse than a cold itself. So if you don't get antibiotics, don't be disappointed. And there's actually quite a lot of other good reasons why we don't overdo the antibiotics. Not only can it not help, but you can actually build resistance to the antibiotics so that when you do need them, when you really are poorly, they might not work. Superbugs have been created through this antibiotic resistance. You might have heard of ones like MRSA that really don't respond to many antibiotics at all. And the fear is in the future, we might have a strain of bug, superbug, that won't let any antibiotic fix it, and that's a bit of a worry. In fact, in 2019, more people died from antimicrobial resistance than HIV/AIDS or malaria. And if we continue as we are, then the statistics suggest that by 2050, more people will die from antimicrobial resistance than cancer. So we do need to take responsibility for not over-prescribing antibiotics, and you guys not taking them and understanding why it's not a good idea. Another reason it's not a good idea is you might have heard about your healthy gut bacteria. I've got a video on it if you want to learn a little bit more, have a watch. And your gut bacteria looks after your immune system. And when you take antibiotics, not only does it kill off the bad bacteria, it kills off the good bacteria. So you actually put yourself a bit more at risk of picking up other infections. And unhealthy gut bacteria also potentially can lead to increased risk of things like diabetes, obesity, even depression. So we do need to look after our gut health. Obviously, sometimes antibiotics are the right thing. Don't want to scare you off completely. So if you've got long-term health conditions such as COPD, or you're pregnant, you're over 65, if you're coughing up any blood, or if you're just feeling really, really terribly unwell, then do call the GP surgery and get some help, or call 111. Also, the guidance says that if you've had a cough for more than 3 weeks, you should contact your GP surgery. But we know that actually a viral cough can continue for 4, sometimes 6 weeks. You don't tend to feel unwell all that time, but the cough itself can continue and you can still be a bit snotty. As long as you're generally feeling a bit better, then I wouldn't panic too much. But if you feel rotten for 3 weeks and not improving, then definitely do call your GP then. So what can you do if you're just going to try and manage at home with these symptoms? Well, I would say drink lots of water. That can help actually loosen the mucus, bring it up. You might want to sleep slightly propped up. That can help sometimes as well. Things like paracetamol, ibuprofen for those headaches and muscle aches. Cough medicine, there's not really any good evidence that cough medicine does work, but it's sometimes worth going to the pharmacy, seeing if you can help. A bit of hot water and honey lemon for that sore throat, or you can get a bit of a throat spray from the pharmacist as well. So see if those things help in the meantime. A lot of people worry if they've got green phlegm, they're coughing up green sputum or green snot, that means it's infected and they need antibiotics. But that's not necessarily true. Actually, that green colour can just be the breakdown of the white blood cells, which is your immune system coming to fight the infection. So there are some instances I would want you to get help straight away. So if you find you've got difficulty breathing, or you're breathing very fast, you've got chest pain, you're coughing up blood, you're very drowsy or very confused, then please do get help straight away, because that could be signs that it's something very serious. Okay, and it's worth mentioning, what can you do to prevent these chest infections or symptoms like these respiratory symptoms in the future? Well, we all know from COVID how important it is to kind of wash your hands a lot. If you're sneezing and coughing, pop sneeze and cough into a tissue, throw it away. Wear a mask around anyone else, because we don't want to pass these viruses on. Or obviously try and avoid being around anyone, especially who's vulnerable. I would also say stop smoking. As you know, I'm sure that's not good for your lungs, but also surprisingly alcohol. Too much alcohol can also negatively impact your immune system within your lungs. And if you are eligible for vaccination, so like the flu vaccination, pneumococcal vaccination, then please do go ahead and get it. That can help protect you as well. I hope you found that helpful. Please do have a look at some of my other videos you may also find useful. Like and subscribe, and I'll see you on my next video. Thanks so much.